This is just a quick informational video talking about how schizophrenia and schizoaffective disorder are not the same thing. I'm Kit, and I'm diagnosed with schizoaffective disorder, which means that I experience symptoms of schizophrenia, such as delusions and hallucinations, but also symptoms of a mood disorder, such as bipolar or major depression. Now, schizophrenia and schizoaffective disorder are both psychotic disorders on the schizophrenia spectrum. They both have the prefix of schizo and both have psychosis as a defining trait. However, they are two separate diagnostic entities, and in my opinion, they can't be used interchangeably. So I'm going to talk about some key points about schizophrenia first. Schizophrenia is characterized by psychotic symptoms such as hallucinations, delusions, and disorganized thinking for a period of 1 month or longer. The Diagnostic and Statistical Manual of Mental Disorders 5th edition, or the DSM-5, describes that this disturbance, meaning the episode, needs to last at least 6 months and can include prodromal or residual symptoms. Prodromal refers to the lead up to psychotic symptoms, while residual is the name for the period after the psychosis mostly goes away. So that 6-month period that is required for the diagnosis of schizophrenia doesn't necessarily mean that the person experiencing these things has to be psychotic for 6 months. In addition, a diagnosis of schizophrenia requires a decline in functioning, whether it's interpersonal relationships, self-care, or occupational issues that is far lower than what the person was doing before the onset of symptoms. A schizophrenia diagnosis also includes these things called negative symptoms, which is the name for things that should be there but aren't. So someone with these would experience maybe lack of emotion or lack of motivation. And of course, a side note is that things like hallucinations, delusions, and psychosis are things that are there that shouldn't be, so they're called positive symptoms. So in short, schizophrenia is dominated by psychotic symptoms. Schizoaffective disorder, on the other hand, is dominated by having mood disorder symptoms for the majority of the illness. The two kinds of schizoaffective disorder are the bipolar type, where the affective side of the condition resembles bipolar disorder, and the depressive subtype, where that affective side resembles major depressive disorder. And both types are characterized by having these mood symptoms for a majority of the time. The schizo side of schizoaffective disorder merely refers to the fact that psychosis does need to happen during mood states, but it also needs to happen when those mood states are gone for a period of 2 weeks or longer. For example, I've been hearing voices for years. We're talking since the 8th grade, and I'm 27 now as of making this video. And it's because I always had those voices, even in the absence of mood episodes, that gave me that diagnosis of schizoaffective disorder. And it's important to note that schizophrenia does not require any mood disturbance to be diagnosed with a condition. And in a similar vein, schizoaffective disorder does not require a decline in functioning in order to be diagnosed. And negative symptoms in schizoaffectives are treated similarly. They're not required for diagnosis, but they can still be present. I think my main frustration with people using schizoaffective and schizophrenia interchangeably is that if I was to call myself schizophrenic, I would be denying the overwhelming mood portion of my illness. The affective side of my disorder, I'm the bipolar type, wreaks the most havoc for me. I can handle my psychotic symptoms pretty well, but when I'm in a manic episode, my entire life falls apart. So saying that I have schizophrenia just doesn't fit, you see? I'd just be missing an entire half of the disorder. So to me, they aren't the same thing at all. Like, yes, as someone with schizoaffective disorder, I have elements of schizophrenia, but I'm not schizophrenic. I'm schizoaffective. My mania and my depression are what I feel the most. It's what I struggle with the most. And in a similar vein, even though I do meet criteria for bipolar 1 disorder, I can't say I'm just bipolar because I'm not. I still have that psychosis. So at the end of the day, as hard as it is to explain to people, schizoaffective is what I've got. It's my only true option, and I'm okay with that. So that's my opinion. What's yours? I know plenty of people use the terms interchangeably, and honestly, I want to know why. And I'm not going to get angry with you if you do use them interchangeably, and I'd much rather hear your perspective than get upset. The internet truly is a great place to share viewpoints. And that's it for this video. Thank you so much for watching and for joining me in making the uncomfortable comfortable. See you next time. Bye-bye.